in 10 seconds. Thank you.
Good afternoon, bon après-midi à tous. My name is Julie Turcotte and I will be your moderator for today. Je m'appelle Julie Turcotte et je serai votre modératrice aujourd'hui. Thank you for joining us for today's media availability on COVID-19. Merci de vous joindre à nous pour ce point de presse au sujet de la COVID-19. A reminder to view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located on the top right corner of the Zoom video screen. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin our interpreters, Amélie and Jen, or follow along on YouTube. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes, Amélie et Jen, ou suivre notre diffusion YouTube. Today, we will be hearing remarks from, nos paroles aujourd'hui seront, Dr. Vera Etches, Medical Officer of Health with Ottawa Public Health, la Dr. Vera Etches, médecin-chef en santé publique de Santé publique Ottawa, Dr. Alan Forster, Testing Strategy Lead with the Ottawa COVID-19 Testing Task Force and the Vice President of Innovation and Quality with the Ottawa Hospital, le Dr. Alan Forster, responsable de la stratégie de dépistage du groupe de travail sur le dépistage de la COVID-19 à Ottawa, ainsi que le vice-président Innovation et Qualité à l'Hôpital d'Ottawa. And lastly, Dr. Ken Farian, Operations and Medical Lead, Ottawa COVID-19 Testing Task Force, and Medical Director of Strategy, Quality and Systems Improvement with CHIO. Le Dr. Ken Farian, responsable opérationnel et médical du groupe de travail sur le dépistage de la COVID-19 à Ottawa, ainsi que le directeur médical amélioration de la qualité des systèmes du CHIO. Following the remarks today, we will take questions from the media. A friendly reminder to please keep your microphone on mute until I invite you to ask your question. Veuillez désactiver votre microphone jusqu'au moment de poser votre question. I will now hand it over to Dr. Etches. Dr. Etches, c'est à vous.
Thank you, merci. Bonjour, Quay. And I really want to thank our hospital and testing partners, Dr. Alan Forster and Dr. Ken Farian, for joining me today to discuss the importance of daily COVID-19 screening before daycare, before school, before work, and to discuss how Ottawa is responding to an increased demand for COVID-19 testing. And before more on that, I would like to acknowledge that tomorrow, September 30th, is the first National Day for Truth and Reconciliation to honor the lost children and the survivors of residential schools, their families, and communities. It's an opportunity for everyone to reflect on the role we all play in helping Ottawa become a safer and more respectful community, free of stigma and discrimination, while walking the path of reconciliation. Cette journée est une occasion pour tout le monde puisse contempler le rôle que nous avons à rendre Ottawa une communauté plus respectueuse et plus sécuritaire, sans stigmatisation ni discrimination, au nom de la réconciliation. So I encourage you to take time to recognize and reflect on the importance of this day. Personally, I'll be wearing my orange shirt and using public library storybooks to raise my family's awareness of the strengths of First Nations, Inuit, and Métis people, and the challenges that remain to achieve fair opportunities for all. At our most recent Ottawa Board of Health meeting, the board received and approved a new report which outlines how Ottawa Public Health is working as an institution towards truth and reconciliation, and you can learn more about that on our website. The latest COVID-19 monitoring indicators tell us that Ottawa is holding steady when it comes to people testing positive for COVID. The local estimate of the reproduction number is just below 1. The percent positivity in our community sits at 2.3%, and hospitalizations are relatively stable. This is after in-person learning has been underway for more than a month. More school-age children are attending school in person, and more are testing positive than at this time last year, likely reflects higher rates in the community. And the number of outbreaks that we're seeing is not kept pace proportionally with the higher number of children testing positive. So this suggests that transmission in schools is being limited with the measures in place. Still, we're monitoring trends and sources of exposure to consider if additional measures are needed. And what concerns me most is the percentage of children who test positive who have been in school while symptomatic, and the high number of high-risk contacts or close contacts that are happening within schools and across social networks. Ce que m'inquiète le plus, c'est le pourcentage d'enfants qui testent positif pour la COVID-19 qui ont été à l'école tandis qu'ils étaient symptomatiques, ainsi que le grand nombre de contacts à haut risque au sein des écoles et des cercles sociaux. So this means that there has been an increased demand for COVID-19 testing, particularly among school-age children. And it means more people have had to stay home from school and work to isolate. So we need to limit community transmission of COVID-19 from entering our schools. So parents and caregivers, please continue daily screening of children using the Ottawa Public Health online screening tool. Please follow the guidance from the screening tool. So if advised to do so, do not send your child to school and then seek that testing right away. S'il vous plaît, suivez les consignes de l'outil d'autodépistage. Et si vous l'êtes indiqué, n'envoyez pas votre enfant à l'école et allez y faire passer un test de dépistage immédiatement. There are many options for parents to seek testing for children. My hospital colleagues are going to speak to this shortly. Ottawa Public Health is working with these partners to facilitate having access to take-home test kits for students, staff, and family members within all schools within a week. The COVID-19 vaccine eligibility for children aged 5 to 11 is on the horizon, but we're not there yet. In addition to maintaining public health measures like physical distancing, limiting our close contacts, wearing a mask around others, and staying home when we're sick, the best way we can help protect children who are not yet eligible for COVID-19 vaccine is for those who are eligible to be vaccinated. And I'm thankful. I want to thank everyone who is still showing up for first doses. We're getting there. It's going up every day. I know many people have started to plan for Thanksgiving and other opportunities to gather with loved ones. You know, fall is here and hopefully we'll have more pleasant weather ahead, but people are starting to move indoors more. So this Thanksgiving and in the weeks ahead, I encourage caution as we plan social gatherings. Concernant l'action de grâce et les semaines à venir, j'encourage tout le monde à faire attention quand vous planifiez des rassemblements sociaux. Making things safer by keeping our number of close contacts low, keep the gatherings small, limiting contacts, wearing a mask. These are the things that will help us keep things manageable. Consider the vaccination status of people that you're gathering with and the vulnerability, the medical conditions of people who may not be able to be vaccinated. My family and I, we're going to have distanced outdoor visits with our neighbors. We'll go for a hike and cook together as a family. So to conclude, I want to say my outlook for this fall is one of cautious optimism. I'm hopeful we can avoid further lockdowns, serious illness and death, or overwhelming our healthcare system when we continue with the current public health measures in place. More protection is coming through increased vaccination of younger populations, and we'll eventually get closer to what life looked like before the pandemic. But let's all do our part to get there as safely as possible. Until then, my deep thanks for everyone for continuing to get vaccinated and for choosing the safer activities. Merci, miigwech. Thank you.
Thank you, Dr. Etches. Je passe maintenant la parole au Dr. Alan Forster. Dr. Forster, over to you.
Good afternoon, and thank you, Dr. Etches, for the introduction and for the opportunity to speak today. Thank you to the Ottawa Public Health and the media for helping us share the vital testing information with our community that we all need. I'm here to provide an update on Ottawa's COVID-19 testing strategy and the steps being taken on a day-to-day basis by our testing strategy task force to rapidly expand capacity to meet the community's ongoing testing needs. Together with Ottawa Public Health and our hospital, laboratory, and community health center partners, as well as people from the city of Ottawa, the Ottawa COVID-19 Testing Task Force has been meeting over the last 12 months, and we have been coordinating testing efforts across the city through that time. Through our partnerships, we have opened new testing locations, introduced online appointment booking systems, launched multiple temporary community pop-ups, and have ramped up resources across the board, all to ensure Ottawa residents have access to timely COVID-19 testing. More recently, we've made a number of changes to respond to the surge in demand that we've seen with kids returning to school. In partnership with Ontario Health, the task force arranged to open a temporary pop-up assessment center at the McNabb Community Center. This pop-up, which was originally intended to stay open for one weekend, has been extended and will continue to provide testing to individuals aging from 6 months or up until October 6th. Other testing sites have also increased the number of testing slots available each day. The drive-through location on Coventry Road recently doubled its hours of operation. And to provide more testing options over the weekend, both the Moody and Ray Friel COVID-19 care and testing centers will remain open on this Saturday and Sunday, respectively. The CHEO Assessment Center at Brewer Park Arena is also actively working to have 400 to 500 in-person testing slots available each day. It's important also to note that while CHEO is specifically dedicated to children, that all of the other sites are able to see children, and that this is taken into account by families when they're making their choices as to where they book their appointments. A number of sites have also paused their pre-travel COVID-19 testing services to shift resources and meet the current demand for symptomatic testing within the City of Ottawa. Despite the introduced measures, we know that more can be done. Currently, across the city, there is capacity to set about 2,400 people each weekday. However, on some days, assessment centers test upwards of 2,600 people. Actuellement, dans l'ensemble de la ville, il est possible de tester environ 2,400 personnes chaque jour de la semaine. Cependant, certains jours, le centre de dépistage évaluant plus de 2,600 residents. Testing is so critical to your family's health and our city's well-being, and we are doing everything we can to address current challenges. With expanded hours, a new pop-up location, and additional resources, next-day appointments are usually available with hundreds of slots still open at many testing sites each morning. Ottawa's labs have also ramped up their staffing and resources to process more tests within 48 hours and often in less than 24 hours. We know that our healthcare workers and system partners will continue to go above and beyond for our city. As demand grows, we will continue to find innovative solutions, test as many residents as possible per day, and ensure timely results are returned. Nous savons que nos travailleurs de la santé et nos partenaires du système continueront de se passer pour notre ville. À mesure que la demande augmente, nous continuerons de trouver des solutions novatrices, de dépister le plus grand nombre possible de personnes par jour et de produire des résultats le plus tôt possible. I want to thank Ottawa Public Health, as well as our many partners, for continuing to support COVID-19 testing in Ottawa. I also want to thank the community for their patience as we work to secure the staffing and resources needed to rapidly expand and meet the increasing testing demands. I will now pass it over to Dr. Farian to provide an update on COVID-19 for testing for children and youth.
Good afternoon, and thank you, Dr. Forster. As my colleague has noted, the task force and its partners are closely monitoring COVID-19 case counts in addition to assessment center capacity and the community's testing needs. In recent weeks, we've seen a surge of kids and youth getting tested for COVID-19. These kids are either showing symptoms that could be COVID-19 or are a high-risk contact following a positive case of COVID-19 in their home, their classroom, daycare, or an after-school activity. We are doing everything we can to make testing easier for parents and caregivers. In addition to the changes Dr. Forster noted in his remarks, there are also a number of new testing initiatives that have been introduced specifically for kids. First, back in May, knowing that children and their parents were avoiding testing because of the traditional nasopharyngeal swabbing technique, we introduced the BON, or buccal oral nasal technique, as an alternative. This method is still sent to the lab for PCR testing. It is not a rapid antigen test, but it uses a softer swab on the tongue, inside the cheeks, and just inside the nose, avoiding the deep nasal swab that it was unpleasant for many children. The BON method is now available at all sites that test children and is the basis for the next two initiatives I will now mention. In August, in anticipation of further demand on assessment centers as schools came back into service, take-home test kits were introduced into Ottawa public schools. Students and staff who are exposed to COVID-19 or who develop symptoms can conduct a take-home PCR self-collection kit using the BON swabbing method that is then dropped off at the school or at an assessment center for testing in the lab. Currently, over 150 of our schools are now participating, and we are working with Ottawa Public Health to expand the number of schools that have access to these kits. Last week, CHEO launched do-it-yourself test kits at the Brewer Assessment Center for kids 2 months of age to 18 years old. Instead of booking a traditional in-person appointment for a COVID-19 test, parents can schedule a time to pick up a DIY test kit. The test kit includes instructions, a registration form, and a self-swab BON PCR test to be completed either on-site in the parking lot, in the car, or back at home. The test kit is then returned the same day to Brewer or one of the other assessment centers for processing in the lab. I want to stress to parents that the BON test method is easy for you to do with your child and provides accurate results. It is a very good alternative to testing performed by a trained healthcare provider. If you need a COVID-19 test for yourself or your child, please keep the following in mind. Parents, students, and staff must complete Ottawa Public Health's COVID-19 school and childcare screening tool on a daily basis. They must follow the steps recommended by the tool, including staying home and seeking a COVID-19 test if required. It might take a few days to book a test and wait for the result, but it is so important to keep your child home if they aren't feeling well. Even if they don't test positive for COVID-19, their symptoms are due to another viral infection that they can pass on to their classmates or teachers. This will only add to more pressure to our city's assessment centers, emergency departments, and our healthcare workers. We know from community surveillance that these other viruses are now very prevalent among kids who have symptoms. If you or your child are unwell, first talk to your primary care provider to help you determine your next steps. Most children and youth with these febrile respiratory illnesses, including COVID-19, will have minor symptoms that can be assessed virtually and managed by you at home in conjunction with a test to rule out COVID-19. If you or your child are experiencing more worrisome or prolonged symptoms related to COVID-19 and are unable to see your family doctor, please book a physician visit at one of Ottawa's care and testing centers. If you are in distress with significant trouble breathing, chest pain, or feeling faint, please go to the nearest emergency department or call 911. There are 9 assessment centers across the city and region that provide a great kid-friendly COVID-19 testing experience. Anyone over 6 months of age can be tested at the Moody, Drive, and Ray Frail sites, the North Grenville Assessment Center in Kemptville, the Centertown and Sandy Hill Community Health Centers, and the pop-up at McNabb. The Somerset West Community Health Center tests children 3 years of age and above, and the drive-through on Coventry Road tests youth over 10 years of age. And finally, CHEO tests children as young as 2 months old. A list of these assessment centers in Ottawa and details on how to book a test can be found at the ottawapublichealth.ca/COVID testing page. To avoid long lineups, please book an appointment for a COVID-19 test online. Additional appointments are added on a day-to-day basis, so we encourage those who are seeking testing to check online frequently for updated availability. I also want to thank parents and all Ottawa residents once again for their patience and for taking the necessary steps to keep their loved ones and the community safe. Please continue to get tested for COVID-19, get vaccinated, wash your hands, physically distance, wear your masks when out in public, and stay home if you aren't well. It all makes a difference, and everyone can make a difference. Thank you.
Thank you so much, Dr. Farian. I will now invite each media agency in alphabetical order to ask their questions. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question ainsi qu'une question de suivi. I will have all of our speakers on camera, and we will start with CBC News Ottawa. Matthew Kupfer, over to you.
Thank you. First, I'd like to ask what you can share, I presume this would be Dr. Etches, about the sources of exposure and spread, the outbreaks that led to the school closure at St. Benedict Catholic Elementary School, and what interventions kind of happened along the way that we ended up with a school closure there.
Thank you. The way we work is to follow up with every school-aged child who tests positive or school-aged school employee, and we identify the close contacts. And if that's a cohort where we think everyone counts as a close contact, we often send that whole cohort home to isolate for the period where they may be incubating the virus. And then in a school setting where we start to see more cohorts affected, and additionally, some people testing positive where we can't find a link to a cohort, that's when we start to think about closing the school to really break any chains of transmission that might have been started, and to, again, offer that testing across the school community. So, there's the concern would rise where there may be more mixing of cohorts that could lead to more than one class being affected. But this is a rare occurrence. Usually when someone of school age tests positive in the school environment, the cohort goes home and we don't see further spread. The majority of the times where we do see it, it's one other person in that cohort that would test positive. So it is rare when we start to see something going on more widely.
Sorry, and I'm really hoping this doesn't spend my follow-up question, but I really was hoping that you could be a little bit more specific about what the situation was at the St. Benedict School.
So it was the case where there were more than one cohort where people had tested positive, and then we were starting to see other children in different cohorts test positive without a link back to those cohorts where we had identified the need for them to isolate. So that was a scenario where we wanted to make sure there weren't unseen chains of transmission happening.
Okay, so for the second question, one of the things that has come out of that is some parents, and this is also happening at other schools, wondering about rapid antigen testing or even asymptomatic testing related to schools. What is the OPH position on that? And we've heard about rapid tests being made available in certain contexts. So is there something that is being made available, and maybe the hospitals can also speak to that, but specifically, what is the OPH policy when it comes to these parents who are asking for this strategy to be available so they can avoid school closures and spread?
I will start, and I invite my colleagues to add. So what Ottawa Public Health is working hard with partners to make sure is that when a school-aged child or someone in the school community needs testing for COVID-19, because they have symptoms or because they're identified as a high-risk contact, that they have easy access to that test. And that's what we're emphasizing today, is the way the testing system is changing and adapting to meet the demand. So in the scenarios we're talking about, where there's somebody who tests positive and the high-risk contacts need testing, we really, the Ottawa Public Health position is we want to use the gold standard test, which is the PCR-based test, so that we don't miss someone. With the rapid antigen testing, it's not as sensitive. And so where someone's at higher risk for COVID, we don't recommend that test be used. The rapid antigen tests are being used for asymptomatic settings where someone is low risk, they're not identified as a high-risk contact. In workplaces, teachers that are unvaccinated, the Ministry of Education is implementing a system. So I think their uses are there and developing. Just see what the hospital partners would have to add.
Yeah, I would concur with Dr. Etches. I think right now the rapid antigen test does not have a role where there are in the schools. It's being currently explored at a higher level. I think a more sort of focus of our energy should be ensuring access to the gold standard test, the PCR test. We've outlined those mechanisms by which we're going to enable that in our community with respect to more sites of operation, more hours of operation, more patient-centered approaches for test acquisition that Dr. Farian discussed. And really our focus should be on making sure that PCR test is available for the high-risk contacts and the symptomatic people, that they can get their test and rule out the disease when if and when it's negative in a fairly conclusive way.
Thank you for that, Dr. Forster, Dr. Etches. I will now pass it along to City News Ottawa with Alex Gouge. Alex, over to you.
Hello, my question is for Dr. Etches. With the school closure at St. Benedict's, how confident are you that the schools will be able to remain open throughout the rest of this academic year?
I'm confident that we'll be able to achieve our goal of keeping schools open this fall, just as I'm cautiously optimistic about the fall in general, because we're seeing right now we're holding things steady. What is important is to continue to think about the number of close contacts we have. And so for students and families, I would encourage, even this weekend or when Thanksgiving comes around, again, the fewer social close contacts we have while we're trying to prioritize school, the better. And until we can see coming on the horizon the vaccination protection for children, there are things we're monitoring, we're looking at, we can make adjustments. I mean, going all the way to a school closure is rare, and we're certainly not seeing anything that would prompt, recommending school closures across the board. I think that we do see that it's not often the majority of the time when people test positive, we're not seeing spread. There are measures that are making a difference in schools, and we'll continue to reinforce those or add to those measures when it looks like that's warranted.
Thank you. And I know you touched on Thanksgiving briefly, but with Thanksgiving just over 2 weeks away, I guess, what advice would you give to residents to ensure this holiday can be as safe as possible for everyone?
Well, I'm really thankful, again, for people who are getting vaccinated. That's a great layer of protection that helps. And then the principles to follow are, when you can choose lower risk activities when they're outdoors, that's lower risk. When you have smaller numbers of people, that's lower risk. You need to think about the vulnerabilities of people that you might be meeting with. If someone has an underlying health condition, if they're unvaccinated children or others, these are all opportunities where, sometimes in the past we've seen a link with transmission and holiday weekends, and we don't want to take off our sense of being cautious this fall too early. We want to continue to hold things steady. This is an important time, again, to prioritize keeping schools, keeping businesses open, and we'll get there. We'll get to a time where there's more protection for children from vaccination. But I just encourage people to keep choosing those lower risk activities.
Thanks, Alex. Thank you, Dr. Etches. We'll now go over to CTV News Ottawa with Josh Pringle. Josh, over to you, please.
Thank you very much. My question is for Dr. Etches, and it just follows up on Matthew's first question about testing and who to a high-risk contact. We heard from a parent tell us that their one child has been ordered to go for testing, but their brother, who lives in the same household, has not been ordered to go for testing. How does Ottawa Public Health determine who is a high-risk contact and who needs to be tested in a situation like a school closing?
Yes, it would be hard for me to speak to a particular situation, but in general, the process proceeds step by step, where someone is positive, and then we identify the high-risk contacts for that person. So that may be one class. We may learn about other cohorts that may be mixed with that cohort, and so it could expand as we get more information from the school or from parents and children about connections between cohorts. Our objective is to notify people within 24 hours, and that is something where we're not quite at target, so I think sometimes there's a little bit of a delay, and we're building capacity to make sure we hit that target all the time. I think in a school closure, that is rare. Again, it's not often. There would be labeling of high-risk contact where there was somebody in their cohort positive, and the whole school wouldn't necessarily be at high risk. But we're taking that step, to make sure that there is isolation in case there are undetected chains of transmission. But I believe that testing is being made available to the whole school population where there is a school closure. We are actually, encouraging anyone who is part of that school, if there's a closure, to be tested, and making the test kits available, so the take-home test kits. But normally we don't have to go that step and test the whole school, because we can identify the cohort. And in a family, so maybe there's one more point, in a family, if someone is a high risk contact, they're identified, say they were in a classroom and someone was positive and they're a high risk contact, again, the family members wouldn't need to be tested normally unless that person who is named as a high risk contact develops symptoms. Then you go down another path where you would have to further explore and protect against transmission in the home.
Thanks for clarifying. Do you have a follow-up question, Josh?
Yeah, and it's just a quick question. The dashboard for public health says there are 10 cases at St. Benedict. The Catholic school says 13 cases. Do you have a number on how many cases? And also, do you know if this is the Delta variant yet that's moving through the school, or is it too early to know for sure?
The way Ottawa Public Health reports the numbers of people linked to an outbreak in schools is where there is an identified link between people. So when we have, say, you mentioned a number 10, that means we're able to put those together in a cohort or across different cohorts where there was mixing. There may be others who are positive who aren't directly linked. And I spoke earlier about that. When we start to see more people testing positive and we can't find links, that could be one of the scenarios where we need to explore further with broader closures.
Thank you.
Thank you. We'll now pass it over to Ottawa Citizen with Liz Payne. Liz, over to you, please. Oh, do I have Elizabeth Payne on the line? Okay, I will come back. We'll move over to the Ottawa Sun with Jackie Miller. Jackie, over to you.
Thank you. I wanted to ask you about mandatory vaccinations for students. The medical officers of health in Toronto and Eastern Ontario, as well as Ontario doctors and nurses and quite a few other groups have called for the province to add the COVID shot to the list of immunizations under the Provincial Immunization of Pupils Act. I was wondering what you thought about that idea.
Yes, Ottawa Public Health definitely would like to see COVID-19 added to the list of vaccines required under the Immunization of School Pupils Act. It allows for a process of collecting the information about vaccination status of students, and that helps us with the follow-up, being more streamlined to identify who is vaccinated and who isn't, and appropriately, dismiss people or keep people in school, ideally, if they're vaccinated. So this is a tool that we would recommend advancing. It's a little different from saying that everyone must be vaccinated to be in school. And I think we have to be cautious at that point, not to exclude, people who are not vaccinated, who really need to be in school for their well-being, for their learning, for their development. We don't want to unintentionally cause more harm by excluding children and families where they've chosen not to be vaccinated. But what the Immunization of School Pupils Act does is it allows us, if there's an outbreak, at that point to say, okay, we can't have anyone who's unvaccinated in the schools at this time. And so that's the typical process using the Immunization of School Pupils Act. At that point, when there's an outbreak, anyone not vaccinated would be excluded.
Okay, thank you. And my follow-up is also about schools. I was wondering if you could clarify what the public health advice is to schools in terms of playing wind instruments and singing. Some parents are saying that it's unfair that sports teams are allowed, but they can't have their kids taking part in a band class with wind instruments or singing.
My understanding is that there are some ways that classes are proceeding in some situations, so I probably would want the team to verify, but outdoors singing with masks on, I believe, is an option. I think that these kinds of ways of reducing the risk are things that people could explore. Obviously, it's much more difficult indoors, to prevent against transmission of COVID, especially when we know that using a wind instrument, can result in more transmission. So we have recommended against using wind instruments indoors, but singing outdoors, those kinds of things lower the risk of transmission.
Thank you.
And indoors, actually, singing can be done indoors as well. Not the wind instruments we did recommend because they're just a little bit more forceful, but singing can be done indoors, and where that's been, the way that we've tried to decrease the risk for that is to say, don't mix the cohorts. So again, relying on, if there was to be transmission with singing indoors, that we wouldn't have it, anything spread beyond the cohorts. But outdoors being preferred.
Thank you so much for clarifying, Dr. Etches, and thank you, Jackie. We will now move on to our last reporter. Nous passons maintenant à notre dernière agence d'immédiat, c'est Radio-Canada avec Laurie Trudel. Bonjour Laurie, c'est à vous.
Oui, bonjour, merci. Je ne sais pas qui peut répondre à ma question en français. J'aimerais savoir, vous dites observer une augmentation de la demande pour le dépistage des enfants à Ottawa. Donc, est-ce que ce serait possible de me résumer en français les mesures qui ont été mises en place pour répondre à cette demande croissante? J'imagine aussi que ça a un impact sur les délais pour se faire dépister si on a plus d'enfants à dépister. Donc, qu'est-ce qui a été mis en place récemment là, pour faire face à cette demande croissante? Merci.
Oui, je peux décrire les mesures d'augmenter la capacité pour les dépistages pour les enfants et les jeunes à Ottawa, parce que c'est vrai, la demande a augmenté. Nos partenaires ont offert des dépistages dans les centres de dépistage avec un plus grand nombre des heures. On a ajouté un autre centre et aussi on a le centre à l'ouest et l'est qui sont ouverts maintenant les fins de semaine. Et il y a d'autres mesures de créer les opportunités pour les familles d'avoir une trousse de dépistage chez eux. On peut faire le dépistage à la maison avec une trousse de dépistage qui vient de les écoles. C'est santé publique avec nos partenaires comme CHIO et où on peut offrir les trousses à l'école et c'est possible d'utiliser chez eux. Et à Brewer, où il y a beaucoup de demandes pour les enfants, il y a une nouvelle approche où les trousses de dépistage sont disponibles pour les familles d'utiliser là eux-mêmes, encore dans les voitures ou de prendre à la maison. Et aussi, c'est important de souligner que les enfants peuvent accéder au dépistage dans presque tous les centres. C'est pas juste à Brewer. Parce que nous avons capacité dans le système, mais c'est souvent que Brewer est occupé, mais il y a d'autres options. Alors, ça, c'est un message clé aussi de partage avec les parents quand ils font leur rendez-vous. Et finalement, je voudrais juste souligner le message de nos partenaires, c'est que on a le but d'avoir espace pour un rendez-vous, pour un dépistage dans la période de 24 à 48 heures et aussi d'avoir le résultat bientôt après. Alors, les laboratoires ont augmenté leur capacité aussi. Maintenant, la capacité dans le système, c'est presque double, c'est 2400 chaque jour. Quelquefois, c'est plus que ça qu'on a atteint. Et on continue de trouver la solution si la demande continue d'augmenter.
Merci. Ma sous-question, peut-être, avec cette observation d'une augmentation de la demande de dépistage à Ottawa, est-ce que vous observez aussi une augmentation du taux de positivité à la COVID-19 chez les enfants que vous dépistez? Donc, est-ce qu'il y a plus de dépistage, mais autant de positifs à la COVID-19 ou plus de dépistage et plus de positivité aussi chez les enfants?
Bonne question. La positivité dans les enfants, ça diminue maintenant. C'est pas quelque chose qui augmente avec le nombre de dépistages. Alors, ça, c'est bon, c'est une mesure qui peut-être décrire que il n'est pas une augmentation peut-être dans la communauté, mais on peut détecter plus. Mais on continue d'évaluer cette mesure.
Merci.
Et Je m'excuse, Julie, je pense que I forgot to answer part of the earlier question about the Delta variant in school.
Absolutely. Go ahead. I believe it was Josh Pringle's question.
So I'm not sure if the person who asked is still here, but there was a question about whether, in a particular outbreak, it's Delta. We don't have that information about which variant it is in a really rapid way. It takes a little bit of time to get information about variants. However, it doesn't change our approach. So we know that, identifying the close contacts, asking people to isolate, it's the same approach, whatever type of COVID it is. And we do expect that some of the COVID in schools is Delta because it is, present in the majority in our community.
That's great. Thank you so much for clarifying. That's it for our reporters today. I want to thank all of our speakers today. Dr. Farian, Dr. Forster, thank you so much for joining us, and Dr. Etches as well. Thank you for keeping us updated on the current situation of COVID in our community. On remercie tous nos speakers aujourd'hui, les docteurs Farian et Dr. Forster, ainsi que la Dr. Etches. Merci pour toutes les clarifications et nous donner une mise à jour sur la COVID-19. Thank you so much. This concludes our media availability.